Vaccination Fact Sheet, Comirnaty, BNT 162b2, COVID-19 mRNA vaccine. First, what Comirnaty is and what it is used for. Comirnaty is a vaccine used for preventing COVID-19 caused by SARS-CoV-2 virus. Adult dose Comirnaty is given to adults and adolescents from 12 years of age and older. The vaccine causes the immune system, the body's natural defenses, to produce antibodies and blood cells that work against the virus, so giving protection against COVID-19. As Comirnaty does not contain the virus to produce immunity, it cannot give you COVID-19. The vaccine is authorized for use under the Prevention and Control of Disease, Use of Vaccines, Regulation Cap 599K for the specific purpose of preventing COVID-19 infection. It has not been registered in Hong Kong under the Pharmacy and Poisons Ordinance, Cap 138. For use of a fractional dose of the Comirnaty vaccine for adults in children aged 5 to 11 years, please refer to supplementary notes on use of a fractional dose of Comirnaty vaccine for adults in children aged 5 to 11 years. Second, what you need to know before you receive Comirnaty. According to information provided by vaccine supplier, Comirnaty should not be given if you are allergic to previous dose of Comirnaty or to the active substance or any of the other ingredients of this medicine, including ALC 0315, ALC 0159, DSPC, cholesterol, potassium chloride, potassium dihydrogen phosphate, sodium chloride, disodium phosphate dihydrate, sucrose and water for injection. Warnings and precautions. Talk to your doctor, pharmacist, or nurse before you are given the vaccine if you have ever had a severe allergic reaction or breathing problems after any other vaccine injection or after you were given Comirnaty in the past. You are feeling nervous about the vaccination process or have ever fainted following any needle injection. You have a severe illness or infection with high fever. Vaccination should be delayed for individuals suffering from acute febrile diseases. You have a bleeding problem. You bruise easily or you use a medicine to prevent blood clots. You have a weakened immune system because of a disease such as HIV infection or a medicine such as corticosteroid that affects your immune system. There is an increased risk of myocarditis, inflammation of the heart muscle, and pericarditis, inflammation of the lining outside the heart, after vaccination with Comirnaty. These conditions can develop within just a few days after vaccination and have primarily occurred within 14 days. They have been observed more often after the second vaccination and more often occurred in younger males. Following vaccination, you should be alert to signs of myocarditis and pericarditis, such as breathlessness, palpitations, and chest pain, and seek immediate medical attention should these occur. As with any vaccine, the 2-dose vaccination course of Comirnaty may not fully protect all those who receive it, and it is not known how long you will be protected. Children. Adult dose Comirnaty is not recommended for children aged under 12 years. For use of a fractional dose of the Comirnaty vaccine for adults in children aged 5 to 11 years, please refer to supplementary notes on use of a fractional dose of Comirnaty vaccine for adults in children aged 5 to 11 years. Other medicines and Comirnaty. Tell your doctor or pharmacist if you are using, have recently used, or might use any other medicines or have recently received any other vaccine. Pregnancy and breastfeeding. Considering overseas recommendations and accumulating real-world data on the safety of mRNA COVID-19 vaccines in pregnant and lactating women, the Scientific Committee on Vaccine Preventable Diseases and the Scientific Committee on Emerging and Zoonotic Diseases, together with the Chief Executive's Expert Advisory Panel, JSC, EAP, recommended them to receive the mRNA vaccines, Comirnaty, including a third dose, as for the rest of the population. Driving and using machines. Some of the effects of vaccination mentioned in Section 4, possible side effects, may temporarily affect your ability to drive or use machines. Wait until these effects have worn off before you drive or use machines. Comirnaty contains potassium and sodium. This vaccine contains less than 1 millimole potassium, 39 milligrams per dose. That is to say, essentially potassium-free. This vaccine contains less than 1 millimole sodium, 23 milligrams per dose. That is to say, essentially sodium-free. Third, how Comirnaty is given. Comirnaty is given after dilution as an injection of 0.3 milliliters into a muscle of your upper arm. You will receive 2 injections given at least 21 days apart. After the first dose of Comirnaty, you should receive a second dose of the same vaccine after 21 days to complete the vaccination course. If you have any further questions on the use of Comirnaty, ask your doctor, pharmacist, or nurse. For use of a fractional dose of the Comirnaty vaccine for adults in children aged 5 to 11 years, please refer to supplementary notes on use of a fractional dose of Comirnaty vaccine for adults in children aged 5 to 11 years. The JSC-EAP recommended intramuscular injection of the Comirnaty vaccine at mid-anterolateral thigh, especially for children and adolescents. JSC-EAP recommended additional doses, that is third and fourth dose, of COVID-19 vaccine for specific groups of persons. For details, please refer to the supplementary fact sheet, Recommendation for Additional Doses of COVID-19 Vaccination. Persons aged 5 to 17 years should receive the second dose of the Comirnaty vaccine at least 8 weeks, that is 56 days, after the first dose of Comirnaty vaccine. For persons recovered from COVID-19 infection, please refer to the fact sheet on COVID-19 vaccination for persons with prior COVID-19 infection. Fourth, possible side effects. Like all vaccines, Comirnaty can cause side effects, although not everybody gets them. Very common side effects include injection site, pain, swelling, tiredness, headache, muscle pain, chills, joint pain, diarrhea, fever. They may affect more than 1 in 10 people. Some of these side effects were slightly more frequent in adolescents 12 to 15 years than in adults. Common side effects include injection site redness, nausea, vomiting. They may affect up to 1 in 10 people. Uncommon side effects include enlarged lymph nodes, feeling unwell, arm pain, insomnia, injection site itching, allergic reactions, for example, rash, itching, feeling weak or lack of energy or sleepy, decreased appetite, excessive sweating, night sweats. They may affect up to 1 in 100 people. Rare side effects include temporary one-sided facial drooping, allergic reactions, for example, hives, swelling of the face. They may affect up to 1 in 1,000 people. Very rare side effects include myocarditis or pericarditis, which can result in breathlessness, palpitations, or chest pain. They may affect up to 1 in 10,000 people. Not known side effects include severe allergic reaction, extensive swelling of the vaccinated limb, swelling of the face. Swelling of the face may occur in patients who have had facial dermatological fillers. A skin reaction that causes red spots or patches on the skin. That may look like a target or bullseye, with a dark red center surrounded by paler red rings. Erythema multiforme. Unusual feeling in the skin, such as tingling or a crawling feeling, paresthesia. Decreased feeling or sensitivity, especially in the skin, hypoesthesia. It cannot be estimated from the available data. Fifth, reporting of adverse events after immunization. The Department of Health, or DH, has an adverse drug reaction, or ADR, reporting system which receives adverse events following immunization, or AEFIs, reports to monitor the safety of COVID-19 vaccines. If you have any suspected adverse event occurred after immunization, please alert healthcare professionals, for example, doctors, dentists, pharmacists, nurses, and Chinese medicine practitioners, when seeking their advice, to report the AEFIs to the DH if they consider that the AEFIs may be associated with the vaccination. For a continuously monitoring of the safety and clinical events associated with COVID-19 vaccination, your personal data collected for vaccination and your clinical data held by the hospital authority and the relevant private healthcare facilities and healthcare professionals may be accessed and used by the Department of Health and relevant organizations collaborated with the government, including the University of Hong Kong, insofar as such information is necessary for the monitoring. In situations when pain or redness at the injection site increases after 24 hours from injection, or your side effects are worrying you or do not seem to be going away in a few days, please contact your doctor. If you do seek medical attention, make sure you tell the healthcare professionals about your vaccination details and show them your vaccination record card if available. Healthcare professionals will then make proper assessment and, if necessary, report any AEFI that is deemed medically significant to the Department of Health for further action and assessment. Please allow the healthcare professional to report the AEFI, with your consent to passing the adverse event case information, personal and clinical data, to the Department of Health for continuous monitoring the safety and clinical events associated with COVID-19 vaccination. For further information on vaccine information and side effects, please visit the website at www.covidvaccine.gov.hk. Message to the healthcare professionals. Please conduct medical assessment, and if you consider the AEFI associated with the vaccine is deemed medically significant, please report it to the Drug Office of the Department of Health via online reporting at the web page. If the vaccine recipient experiences serious adverse event following immunization, please refer the recipient to hospital. Please read carefully the following paragraph, which is found on the last page of the fact sheet. Put a tick in the box to indicate agreement. I have read and understood all information as provided in the fact sheet and the statement of purposes of collection of personal data, and I consent to the administration of COVID-19 vaccination to me or my child or my ward under the COVID-19 vaccination program. And the Department of Health and the relevant organizations collaborated with the government, including the University of Hong Kong's access to and use of 1. My or my child or my ward's personal data contained herein, and 2. My or my child or my ward's clinical data held by the hospital authority and the relevant private healthcare facilities and healthcare professionals, for the purpose of continuously monitoring the safety and clinical events associated with COVID-19 vaccination by the Department of Health, insofar as such access and use are necessary for the purpose.